Today we're looking into chiropractic care, based on some info you brought in from Advantage Healthcare of Spartanburg.
That's right. You're curious about their kind of holistic view on wellness.
Yeah, exactly. So let's jump right in.
Absolutely. And what really stands out from their material is this idea of the body being, all connected.
Interconnected. How
So
so?
like how tissues, nerves, bones, they're not separate things. They all influence each other. And the goal seems to be finding real long-term relief, not just patching things up.
Okay, interesting. So based on what Advantage Healthcare says, what is chiropractic care at its core? Let's break that down.
Well, they describe it as natural, definitely non-invasive, and drug-free.
Right.
It's focused on figuring out, treating, and even preventing issues with muscles and the skeleton, especially the spine.
And you mentioned it's not just one standard treatment.
No, exactly. It's personalized. That's key. Treatments can really vary.
How does that personalization actually work in practice? What kind of things do they do?
It could be manual spinal adjustments. That's where they, use their hands to gently realign the vertebrae.
Okay, the hands-on stuff.
Yeah, but they also might use specific instruments for adjustments or different kinds of massage therapy. Sometimes even nutritional advice comes into play. It really depends on the person.
So it sounds like it's quite a bit more involved than just the cracking sound people often associate with it.
Oh, definitely. The main aim is to really find and eliminate the cause of the pain or discomfort.
The root cause.
Exactly.
Um,
Reducing inflammation, helping the body kind of find its natural equilibrium again. They do mention those hands-on adjustments for vertebrae alignment and also deep tissue massage if muscles are really tense.
That makes sense. So digging into the specifics a bit,
Yeah.
what common problems do people see a chiropractor for, according to this source?
Back pain is a really big one.
You bet.
Yeah. And for that, they'd likely use those spinal adjustments, maybe for things like slipped or herniated discs, trying to take pressure off nerves. And massage, too, for tight back muscles.
What about neck pain? So many of us get that right from like screens or stress.
Definitely. They tackle neck pain from various causes, whiplash, maybe a misalignment, but also things like anxiety or just bad posture from sitting all day.
It's interesting they link it to things like anxiety too.
Yeah, it shows that interconnected idea again, how physical and maybe emotional states can tie together.
And headaches. Do they address those?
They do. Migraines and tension headaches are mentioned specifically,
What?
and they often trace those back to muscle tension, especially in the neck and shoulders, which could stem from a spinal misalignment or even an old injury. They're looking for that structural link.
Right, the underlying structure. And what about sciatica? That sounds pretty rough.
It can be really debilitating, yeah. That pain radiating down the leg from the sciatic nerve being irritated.
So what's the approach there?
Again, it's about relieving the pressure on that nerve, reducing the inflammation that's causing the pain, trying to get to the source.
Okay, so running through all of this, there's this recurring phrase in the material, a gentle, holistic approach to wellness.
Exactly. That seems central. They really stress long-term healing over just, a temporary fix. They even talk about treating the entire body and lifestyle, which again circles back to that interconnected view we started with. Find the root cause, get lasting relief.
Okay, let's sort of wrap this part up then. From this deep dive into Advantage Healthcare's perspective, chiropractic care comes across as a natural, hands-on method for muscle and joint problems.
Yeah, using personalized treatments like those spinal adjustments and massage techniques.
Right, to target the why behind issues like back pain, neck pain, headaches, sciatica, aiming for that long-term relief.
Precisely. And it really gets you thinking, doesn't it, about how intricately linked everything in our body actually is.
It really does. And that leads to a final thought for you, our listener. Considering this emphasis on the interconnectedness of your muscles, bones, and nerves, what other parts of your overall health and well-being, maybe things you haven't even considered, could be influenced by your musculoskeletal health? Something to mull over. Thanks for joining us for this deep dive.